See you so don't give. No one is listening. Praying to myself. Would see you so asking. No one is answering. Can you hear me now? Can you see me? Hey folks, it's Loyce here. I just want to say that we'd love for you to start dropping in the chat what you've gathered from the summit so far, whatever you've been able to join. We're going to let folks trickle in a little bit longer, maybe a minute or two, and then we'll hear some report outs from all of our fabulous facilitators. Enjoy Emily King for now. Thanks. You so trying. Everyone thinks we're wrong. Well, I'll keep singing to myself, hoping that somebody they're gonna sing along. Help me sing this song. Can you hear me now? Can you see me now? If I cry out now, will you believe me now? Can you hear me now? Can you see me now? If I cry out now, will you believe me now? Hi everyone again. I'm so grateful to be finishing my week with you. It's Loyce again. Might have caught me tearing up a little bit, but I think it's just such a nice moment to share with you guys now, especially on the tail end of what I think were a lot of heart-filled conversations, at least for me, over the past couple of days, and honestly, hopefully over the past few months. As I shared as part of our opening, we at Global Health Council have really been wanting to create space, and as someone has said, not just safe space, but brave space for people to step into and live fully in. And I hope that we have achieved that for you to some degree. I think we still have a bit to go, to say the least. But I'm incredibly grateful that you all have been a part of this conversation on pandemics, politics, and privilege, and specifically what we as US actors can do to really look closely at what power and privilege has looked like in our space, in our work, even with the best of intentions. So with that, instead of me going through all of the things that I gained from each of you, I think I want to go ahead and turn to a number of people that we've asked to support us throughout the event. And again, my sincere thanks to everyone who played a role here, from staff and consultants that we were able to bring on board, to obviously all of our speakers and guests, and of course our fabulous crew of advisors and facilitators. I'm hoping that we can start with Bobby, because I know that you were a part of the pandemics section yesterday. Perhaps you can offer some closing remarks for people who weren't able to join that then. Thanks.
Great. Thank you, Loyce. I have really enjoyed, this conference. And, Dr. Modi from WHO, she expressed that the pandemic itself has highlighted the widening inequity that is showing up in the US Black Americans. That this disparity has just been, exacerbated even more. But the global narrative, what you hear on the news and see on TV around the African countries, they only account for less than 4% of the global COVID burdens and death. But the global narrative was how the worry and the concern and how there was going to be so many deaths. And again, that news and that narrative around it just hasn't been helpful. So these highlights and takeaways highlighted the need to invest in equity and justice, and not just in the U.S., but in countries that we shouldn't just be dominated by the narrative that things are going to go have problems, and the stories of resilience always are being left out. Dr. Kisang from Advocacy had a great quote. He says that we know what to do, but we do nothing. And that has just been, we knew from the pandemic, we knew the things to do, but just did nothing. So at least in the US, he and others, he was offering a different way of looking at health security, where it's not just the national level, but involving the region and strengthening the public health institutions so that Africa, the global South, and others, they have the ability, the coverage, the conversation, the resources to strengthen their own systems, not to outsource the health security to others. No matter which administration, you want to have that ownership. So I thought those were really powerful insights from the panel. And then during the breakout sessions, we talked about how the pandemic is definitely, causing a mistrust in science. So hopefully there'll be a return to science and the knowledge and speaking about the resilient countries, Nigeria, Ghana, and the ownership of solutions to the pandemic in the future. Thank you.
Thanks very much, Bobby. Powerful words and takeaways from our guests for sure. Crystal, Bobby got a little bit into this, but I know that you, with Aljane, really helped lead on the politics sessions that we had over not just yesterday, but today as well.
Yeah,
Care to offer some takeaways for us?
absolutely. And for my personal takeaways, this has just been such a great, like you said, an emotional couple days, particularly as a Black woman working in global health. It's not lost on me how important it was to see so many Black and brown faces speaking up and speaking out and being in the front of these conversations. So kudos to Global Health Council for leading the way on this and reminding us that we really have to, leadership requires you to play different roles, which came out in our session. The US is used to being a leader on the front row. But being a leader, Representative Barbara Lee, I mean, all hail, man. She laid it out and she said, we can learn from our African partners. And being a leader means sometimes you step aside and that means you're behind. That means you're next to. It doesn't mean always in front. And I think it came out in a lot of our sessions that we are so used to being the US in front. And for me, as one of those champions and advocates, like US must be a leader in global health and all those, it was a reminder to me. It doesn't mean we don't stop giving because we need to give. It doesn't mean we don't stop helping where we are possible, but that doesn't mean we're in front. It may mean that we're behind or partnered and next to on the same line, or maybe we're far behind like we've been on COVID, where other countries have been like, oh, we want not to do that. And I think that came out of a lot of our conversation. Another big thing that came out this morning, which was so wonderful and refreshing, was, you know what, we've done a lot of really great things, but we have to figure out what's going to work for the future. And that was really marrying that congressional work with the implementers and saying that, many times we are working together, but may not be listening to each other and maybe not being flexible enough to realize that we have to pivot a little bit on our processes and investing, overall message. We got to invest in those health systems while addressing global health security issues. It's not an either or. And so again, big thanks to Global Health Council for bringing together some powerful people. From the start out of the gate with Salome, man, she like rocked my heart. So thank you for, bringing, new voices to the front. And that's what we heard throughout our session is thank you for the voices. Thank you for the opportunity. Thanks for just being you.
Oh, thanks, Crystal. Appreciate you and everyone else who had a hand in this again. I want to actually turn now to Itzbeth Menjivar because she has been instrumental in helping us sort of convene and have conversations at the CEO level, because I think we all know that in addition to sort of the policy and programs on which we all are either leading or partnering, to Crystal's last point, we also want to ensure that there's practice at an executive level that supports these changes. And so rest assured that there was leadership that came together throughout the week as well, a couple of times to talk about this, and reflect on these themes as well. So Itzbeth, would you like to offer some remarks in that regard?
Sure thing. Thank you so much, Loyce, for the invitation to provide this summary. We had a conversation on Wednesday called Walking the Talk, and really hearing from Black CEOs on their experiences, just their career and life experiences. And I just want to sort of summarize the comments of Dr. Georges Benjamin, Dr. Armenia Palacio, Ms. Anuka Brown-Saunders of UNICEF, and Loyce's comments as well. And I'm basically summarizing what I think are some of the comments that I think are worth bringing up and keeping for ourselves. The first one is that Black CEOs have to speak more than one language. We see and hear things differently because of our lived experiences. So we have to think about how to present information through those lenses of others so that it can be understood. And this requires quite a bit of listening. And it can sometimes feel like we're sort of manipulating a situation, but it's really about how do we influence? How do we have our voices be heard? And Loyce brought up the great point that in some cases, this is really a survival skill for Black professionals in general, but particular for Black CEOs, because it's not only how to make it into the position, into the role, make it to the table, but also how to stay in the position and needing to bring in up those communication strategies to be able to do that. The next point is that Black CEOs feel a responsibility to serve as role models and leave the environment better than we found it. In order to remain at the table, we must navigate the discomfort of our white counterparts while finding strategies to keeping them at the table and continuing to have the conversations that are needed. For me, I think it points us to the need of understanding the difference between comfort and safety not being the same thing, and understanding that if we don't have this uncomfortable dialogue, the safety, the actual physical safety of Black and Brown people is at risk. So we're asking for people to really push into their discomfort. Another comment was that Black CEOs have to form relationships that are culturally, professionally, regionally, politically far away from when we've started, or far away from when we may locate ourselves. And that, we come into these conversations in different manners, and it has us needing to be much more attentive to what people want to hear. So not only what they need to hear, but we need to work in what they want to hear as well. And somebody mentioned that racial equity is fundamental to basic public health, and that we have not just the opportunity, but also the obligation to do better. And in today's session, we talked a little bit about, what's the work that is happening, what needs to happen. And a takeaway that I had from sort of today's conversation with the CEOs is that there is a lot of work that is going on. There's some organizations that have been doing this work for years. Others are just beginning, but we're on a journey, on a collective journey towards learning a different way of doing things, and that it comes with challenges. And some of those challenges are that some of these diversity efforts, we've noticed that they result, particularly in the health field, in a high number of female professionals entering the profession. So the diversity efforts, as we've seen with affirmative action in the first, is that white women tend to be the biggest beneficiaries of diversity efforts. So it really requires additional intentionality to ensure that diversity doesn't only mean gender diversity, but that we have racial, ethnic, background, all of the other types of diversity. And that there is a feeling, particularly for white CEOs, of feeling stereotyped, feeling like, well, you don't know what my life experience is, you shouldn't put me in a box. And what for me, the reflection for me is that this is what people of color have been dealing with for generations, that we don't have the privilege of being treated as individuals, but rather as the group. And for me, I think it's just an invitation of understanding the feeling and understanding that this is what people of color have been dealing with, and that we have an opportunity to expand our compassion and expand the ways in which we're building trust with our staff and communities to ensure that we can work together. Thank you so much, Loyce.
Thank you, Itzbeth. And I had the pleasure of being a part of both of those conversations. And I have to share that I was heartened as well, that organizations are doing the work. CEOs are committed to doing the work. And so it's not just about the statements and commitments, but real action towards change and I think a true investment in the time and resources required to realize progress. So I'm hopeful, and I'll be watching and waiting and doing myself, to be fair. The last person we're going to hear from, last but not least, is the fabulous Angela Bruce-Raeburn. And I know that she has offered to give us some takeaways, some of her reflections on the themes of privilege, which we started out with yesterday, as was referenced earlier, and then power, which kind of got us started today. So knowing that both of these issues, obviously are sort of undercurrents to everything else that we do, I leave it to you to finish us off with your reflections. Thanks a lot, Angela.
Thanks so much. Hi, everyone. Loyce, also first, thank you for looking at all the pictures and reading all the bios of all those amazing people that you brought together. I was like, yes, this is making me so excited. Itzbeth, I'm going to end where you just took us, this conversation around discomfort. Yesterday in our panel, Stephanie Camus did a presentation, and it was about the lens by which we do international development, and especially how it looks in the health sector. And she talked about these really important things. And the takeaway was discomfort. And when you said that, I said, okay, perfect ending to this discussion, right? Discomfort. She said, when we went into the breakout rooms, when people were saying things like, well, I feel uncomfortable and I'm a little bit, feeling a little bit not in my element. The takeaway was that is our everyday lives. That's our experience. So the moment of discomfort that you're feeling in this very difficult conversation, know that I wake up every day and I go to work every day and I live and breathe this every day. So here's what we wanted you to take away, people that listened to us yesterday. Let your discomfort guide the change. Think about that. Let the fact that you feel uncomfortable allow you to go into your organizations and challenge. Ask the question when we're talking about local NGOs, who controls the money? How about, is your partners are your partners in these countries really partners? Or are they just organizations that you are, that they do basically what you tell them? Let your discomfort allow you, when you go back to work, to challenge what's happening in your organization, to ask those tough questions, because that discomfort will allow us to see change. Let's not take your discomfort and allow it to be a barrier. Let not it be that your fragility is making you so uncomfortable that you don't want to use it as a catalyst for change. And so if there's nothing else that came away from our session yesterday, it was that that question, that sort of, we threw down the gauntlet. Let your discomfort guide the change. I want to say thank you, Loyce, for allowing me to just give this last, comment, because I talked to Stephanie about it today, and we both agreed that this is what we wanted to leave everyone with. Thank you.
I love it. Thanks, Angela. I appreciate that. And regards to Lori and Sarah as well, who also helped on that that privileged power sort of theme. I know a lot of us heard from Winnie as our keynote this morning, and our great panel around solidarity. So I think it really shows that, you know, a lot of us, especially in the BIPOC community, are really great at turning pain into power. And so, if nothing else, I'm left with that too. That might be my greatest takeaway, although I didn't plan on sharing. But the value of stepping into my full self, and inviting others to do the same, which I have found incredibly powerful. And I've seen that come through in each of you on the screen, and everyone else behind the scenes. So I think that's all we needed and wanted to share now. We didn't want to sort of leave you by the wayside. We know it's an odd year when you have an event and, you know, you just sort of leave the Zoom and that's all. So for those of you who were seeking that anchor or touchstone, here you are. But thanks for joining us. Those of you who came to the official closing, I'll share or remind you that we will, of course, be sending out a survey to each of you so that you can tell us more of what you thought of what we pulled together. We know that we can still grow and learn, even though we tried to make it cost-free and accessible. You know, there are many things we could still do. Obviously, we've tried to make it diverse, but I know that you all, if I know this community, has plenty of ideas as to how we build on this. So happy to receive those. Also really glad that you all shared in the chat what your takeaways were, and we will be capturing those as well as other comments throughout the past couple of days as part of our official report, which we'll publish at some point in the future. Give us a little bit of time with that, but we'll be sure that that's available for people to share who weren't able to make it. Again, these recordings will live online too, much to my dismay, but it's fine because it's important. People want it, we'll do it. So yeah, with that, I think I just want to extend my sincere thanks again to everyone, especially all of our attendees. But also our sponsors, who I will call out by name because, you know, it's not easy to support this work, especially to put funds behind it. And obviously GHG is fueled by contributions from our members and other partners. In particular, this year, we had some great supporters for this event: CARE, Core Group, DAI Global Health, FHI 360, Friends of the Global Fight Against AIDS, TB, Malaria, Medtronic Foundation, Merck, Novo Nordisk, and UN Foundation. I think if we just want to put up the thank you slide, I think that's what we'll leave people with, because I think that's the sentiment that we all have and share this afternoon. So with that, we appreciate you. Thank you so very much, and take care.